oh, Dr. McGill, if I don't ride the elliptical, it's my stress reliever. I'm going to come home and murder my kids.
Yeah.
And I'll say, fine, go and have your surgery. Roll the dice. They might repair your disc, but you will go back to the thing that caused the pathology in the first place. And chances are the surgery will fail after a couple of years, but, go ahead.
Hello, my friends. Welcome to another episode of Better with Dr. Stephanie. It's me, your host, Dr. Stephanie Estima. This episode, and without one iota of exaggeration, if you have ever experienced any type of pain, whether it be back pain, pain in your joints, this is going to be the episode that you are going to want to listen to, and you are going to want to share with anyone that you know that is suffering from chronic or acute pain. My guest today is Dr. Stuart McGill. I can't even believe I'm saying this because this is the man that I studied when I was a little bitty squeaky chiropractic student back in 2002. I believe his book came out, Low Back Disorders. It was the Bible that all of the clinicians and students lived off of. His work is legendary. I have been following his work, I guess, for the better part of 23 years, and the research that he has done still stands true today. So, a little bit about Dr. Stu McGill. Get ready for this bio, guys. He is a distinguished professor emeritus of spine biomechanics at the University of Waterloo, where he served for over 3 decades, 30 years, renowned globally for his pioneering research into the causes and rehabilitation of back pain. Dr. McGill has authored more than 240 peer-reviewed scientific papers, has 4 influential books, including Back Mechanic and Low Back Disorders. So Back Mechanic is the one written for the lay public. Low Back Disorders is the clinician's book. His expertise is sought out by elite athletes, medical professionals, organizations worldwide. In recognition of his significant contributions to spinal health, he was appointed to the Order of Canada in 2020. Currently, Dr. McGill continues his work as Chief Scientific Officer at BackFit Pro, Inc., where he consults on complex back pain cases and educates clinicians through the McGill method. All right, so couple things that you need to know about this episode that are going to help with the success and deriving as much value as you can. First, Dr. McGill is he always wants to give a visual representation of what he's talking about. So as we were talking in this episode, he would get up from his chair, get down on the floor, and show us what a bird dog was, show us how pain might be concentrated in the sacrum so he's up and down out of the chair all the time. So you would really benefit from watching this episode on YouTube. So you can listen to it on audio, but there's going to be times where you're going to hear him get up from the chair and get down on the floor. So if you want to see what he's doing, watch it on YouTube. The other thing I'll say is that when we're talking about the amount of detail in this episode, we go on a little nerd safari together. So there are a couple of big words that are thrown around. I always do my best to sort of bring it back to everyday language, but you will hear me drop words like zygapophyseal joint and then correct myself and say, oh, the facets. He talks about PNF, or proprioceptive neuromuscular facilitation. So there's a couple of on the scale of light roast to dark roast, this is a dark roast Betty episode where we do talk. There's a couple of big words, there's a couple of big concepts in there. However, one of the geniuses of Dr. McGill is that he is a master in applied science. So he can talk the science, but then he's going to show you what that means. So hang on. There are a couple of points where we do kind of get lost a little bit, but I know that if you hang on and you wait for the action items, the applied science part, you're going to really love it. I have to tell you, as someone who has studied and followed him, he is one of my heroes. He's made me a better doctor. I studied his books. I've been watching him, reading his research for years. And so he helped not only myself become a better doctor, but he also benefited my patients because of it. So I hope that you enjoy this incredibly special interview with Dr. Stuart McGill. Well, this is such an honor. Dr. Stuart McGill, welcome to the Better Podcast. I am delighted to have you here today.
Good afternoon, Stephanie. I've heard a lot about you.
Oh, I am so honored, humbled to hear that. And certainly I had your book in chiropractic school, Low Back Disorders. It was my Bible. And to have you here is just a wonderful full circle moment for me. And I wanted to have you on the show because I think that the stat that I was told in school, I think it probably still holds true today, is at some point in our lives, at least across the population, about 80% of us are going to experience some type of acute low back or any low back pain in general. And I think that it's when I'm thinking about how to age well, and I'm thinking about my listeners who are tuning in to hear what we have to say about back pain, certainly how we can set ourselves up in the best way possible to avoid, if possible, injury. And then if we are injured, how we can understand where the root cause of it is happening, where it's coming from, why it happened, and then, of course, the treatment to be able to recover it as well. So with that, can we start with some basic anatomy of the spine? We don't have to go into, exact angles of the facet joints, and we don't have to do that, but certainly just an understanding of the curves in the spine. What are some of the main players that we see when we are talking about sort of pathomechanics or injury? So maybe a conversation around the facet joints, the discs, and then where we are more vulnerable to injury.
May I start with some basic foundational principles, and then that will create a context for us to discuss the various parts.
Absolutely.
So I've been asked what causes back pain many times, and I've given the answer. Anatomy loads the gun. Exposure to specific loads pulls the trigger. And the psychosocial milieu of the person's life governs their behavior after the initial mechanical tissue insult and subsequent pain sensitization process. So if you just treat the psychological, you won't fail to really address the cause. But once the pain has started and you're under pressure to stay at work and feed your kids, and this sort of psychological social pressure, you can see how that impacts on the whole situation. So that's a start on that for context. The second is a generalization for health. Think of every health system in your body. We have a musculoskeletal system, a cardiovascular system, an endocrine system, even a psychological system. Every single one of those requires stress for optimal health. If you do not stress the system, it becomes weak and fragile. If you overstress it, you then create cumulative microtrauma to that system. In other words, there's a tipping point. So sufficient strength, optimal strength, is good. It's anabolic. It builds us all. And when we cross the tipping point, we go into catabolic processes or cumulative injury. Now that, as I said, is pan-system throughout the body. The third piece of information to give context to all of this is the spine is only a link in a articulated linkage, the skeleton. So you can imagine if I just do this and I wiggle my finger very quickly, I can wiggle it very quickly and athletically if I stiffen my wrist. But if I don't stiffen proximally, I don't have the ability to control it. It's all over the place. So because we live in a linkage, proximal stability allows distal athleticism. And the mother of all proximalness in a skeleton is the core. So there's, we can define the core many ways, but that would be a beginning there. So if I was to create a push with one hand, if I didn't create an inertial battleship, something very solid in my core, I would create a distal push and I would push my own body away. But if I establish a root, and then when I push, I'm not firing from a canoe, I'm firing from a battleship. So these are all concepts that are critical in our initial discussion about spine function.
Well, I love it. I mean, it also honors, whenever you're thinking about, you mentioned pushing. So this is, if you are lying on a bench, you are going to provide stability to the shoulder joint in order to maximally activate or maximally recruit some of the muscle fibers that are in the pec minor and major, and versus if you were to just stand without that sort of maybe it's not endogenous stability, with the bench, it's like an exogenous piece of equipment, but that is really fundamental even in when we're thinking about building muscle. It's like the more stable the surface or the more stable the movement pattern is, whether that's generated from the core or elsewhere, sitting on a bench or lying down on a bench, what have you, then you're going to be able to actually recruit more muscle fiber. So it makes a lot of sense that we're talking about stability in the way that we are. And proximal stability we're going to talk about with the core. And I know that that's a big point of focus, certainly for women who have had children, pregnancy, labor, delivery, and then moving into sort of, perimenopause and menopause, where we're seeing changes in hormonal status that can change sort of the integrity of even like the pelvic floor, which is the bottom of the core. All that
Right.
to say, I agree with you.
Yeah, I was just going to give a quick demonstration by standing up. If I stand up and I do a knee circle, if I have proximal stability, I arrest all the micro movements in my core, and I've just created the athleticism about my hip joint to free my foot. So there would be an example. Now, a violation of that principle is when a person freezes their hip and uses their spine as a reptile would. And then we can now talk about stress concentrations. So what we did in our laboratory for almost 40 years was we measured stress concentrations throughout the spine and throughout the body. Pain and injury almost always occurred where the stress concentration was the highest. So that answers a lot of questions as to why certain parts of the spine are much more vulnerable in certain types of occupations that have similar exposures to certain tissues in the back, and particularly among sports. There are certain sportsmen and sportswomen who get very particular types of back injury. So the stress concentration is a big deal. Now, we all voluntarily migrate stress concentration. So if I take my elbow, I can move my elbow throughout the range of motion under muscular control. It's quite stress-free. But if I lock out my elbow, so now the resistance to motion transfers from the muscle onto the bony interface. That's called an arm bar in jiu-jitsu, and it will cause so much pain. If you don't submit, you will actually dislocate or fracture your elbow. So my point is, unknowingly, people will violate this idea of distributing stress concentrations through their back, not realizing it, and cumulative trauma will occur. So now we can talk about applied load. Applied load can be magnitude. That would be, say, a woman 50 years old who's been with a trainer. The trainer's worked with her for half a year, and he learned on the internet that every woman is not a real woman until they deadlift twice their body weight. And the trainer got the client to do that after 6 months. There's no way they could build the bone that quickly. They might have built muscle strength. Muscle strength is relatively easy compared to bone strength.
Yeah.
But they exceeded the tolerance and they created a stress concentration. And now that a woman who went to the expert for better health actually became injured. But anyway.
This is the amplitude. Of the load that you're talking about.
That's the magnitude of the load that was excessive. Now, the next person never did a deadlift, but they sat in a chair hour upon hour. If they have had a little bit of wear and tear on the annulus of the disc, so in this model, let me just back up a little bit. So there's the pelvic ring, there's the sacrum or the tailbone, shall we say, and the fifth, the fourth, and the third vertebra. So everyone knows where that is in the spine. The hip joints are ball and socket joints. These are not ball and socket joints. These are actually layers of collagen fibers. They're a fabric and a biological adaptable fabric. So they follow different rules as well. My shirt is a fabric. If I take a certain section of the fabric and I create stress-strain reversals, chances are the fibers won't tear. They will slowly delaminate. Now, the inside of the disc is filled with a gel, a pressurized gel. If the person creates stress concentrations by loaded movement, so you need a bit of load and moving over and over and over and over again, loosening the binding collagen that holds the main type 1 collagen, as we call it,
Type
the
1.
strength
Yeah.
collagen,
Yeah.
type 1
Yeah.
collagen.
Mm-hmm.
It's a type X collagen. So type 1 is strength collagen. Type 2 is elastic collagen. That's about 80%. And then there's the third type collagen that binds all those fibers together. Those are the ones that adapt. So if the person does repeated loading, if you don't load, you can move your spine back and forth. It was so interesting. We did a study of Middle Eastern belly dancers. They have incredible motion and gyrations of their spine. They really didn't have any back pain or measurable cumulative trauma in their backs. But then again, when we asked them to do sit-ups, not one of them could do a competent sit-up. So they weren't strong, but they were incredibly mobile. And we see this time and time again.
Yeah.
But if you add strength to a lot of mobility to the annulus, you have a much greater chance of delaminating the collagen. And that's what will lead to a certain type of disc bulge, as an example. So that might be one pathway to pain, maybe not through magnitude, but maybe through repeated motions or through a prolonged motion, like a poor posture, slouched sitting could cause that, as an example. But another fairly potent pathway to a disc herniation is to first damage the end plate, which is the top and the bottom of the vertebra, and that compromises the seal of the gel-like annulus in the middle, and now it seeps up vertically into the vertebra. Yeah. Mm-hmm. The disc now loses height, and it bulges just like letting air out of your car tire bulges. And as it bulges, you can see the delaminating stresses in the collagen fibers as they slowly work apart. And that actually makes it easier to create a posterior disc bulge. And we saw this. We would create this in cadaveric spines, as we did, as I said, for 30 years. But last year, 2025, the Issels Prize, which is the top lumbar spine science prize in the world, was won by Rajasthan's group, and they measured when a surgeon harvests the extruded nucleus in a disc herniation operation, and they analyze it, more than half the time there's broken bits of bone from the end plate, meaning that that injury started with an excessive deadlift, and the person got away with it. But over time now, that accelerated the disc herniation. So it started with a violation of the tipping point in compression, and then bending really propelled it. So there are several pathways to create the stress concentrations, but I started this little line of logic with it could be magnitude, it could be too many repeated motions, or a single prolonged motion. Now, may I just expand this to one more concept, and it's the critical one, Stephanie, which is rest and positive adaptation.
Please, yes.
Okay. So as I started out this whole conversation, systems thrive on stress. Some people simply don't add enough rest after stressing to give biology time to create a positive adaptation. So they'll say, I go to the gym every day, and this is very common among the population of your audience. Some of them don't move enough, and some of them move too much. Every day they go to the gym and ride the elliptical for 20 minutes. And then they come here to BackFit Pro, and we put them on an elliptical, and we measure it. That is the thing that is stopping them from desensitizing. Every day they pick the scab, but they say, now here's the psychology of it. Oh, Dr. McGill, if I don't ride the elliptical, it's my stress reliever. I'm going to come home and murder my kids. And I'll say, fine. And I think we're going to talk about this a little bit later. I'll say, go and have your surgery. Roll the dice. They might repair your disc, but you will go back to the thing that caused the pathology in the first place. And chances are the surgery will fail after a couple of years, but go ahead. But I'm going to offer you something else. It's called virtual surgery. Let's pretend you had surgery. Well, what would you do the day after? Are you going to the gym and riding the elliptical? No, you're going to bed. And you're going to get up 3 or 4 times throughout the day, go for a pee, and then go back to bed. And the next day, you're going to add very short little walks down the hallway and build yourself back with graded exposure and allow biology to wind down your pain and start the repair process. That's why surgery works for many people. I mean, clearly, for stenosis and whatnot, surgeons are at their very best with heavy stenosis.
Sure,
and they have to remove
cauda equina. We're not playing around with that.
Sure.
Yeah, totally.
So I'm not criticizing their role in the whole healthcare rubric, because we absolutely need them sometimes. But this is not the time that we're talking about. What was it, a 50-year-old woman, I think? She'd been told that, the last thing for you is surgery, but no one ever went back to analyze what the pain pathway or original mechanism was. So let's pretend they had surgery. We're going to mock up their recovery without giving them surgery, but pretend they did. And do you know, when we did that, and these are all patients who were told, you've tried everything now, the last hope for you is surgery. Follow the principles of biomechanics, the book I wrote for the lay public, which has a large portion of this with virtual surgery. 95% of them, after a 2-year follow-up, had avoided surgery and were glad that they did. So one thing we did at the experimental clinic at the university was we followed up with every patient we ever saw. I don't know of another clinic in the world that's done such extensive follow-up. Now, I'm not saying we had that score with all of the subcategories of pain, but at least with the ones who were told they needed surgery and no one had looked at what the causal pathway was. Anyway, there's a little bit of an essay, I suppose, on that. We didn't talk about specific injuries to different back parts. We can, if you like, and why that happens. But is that a little bit of an overview that you were hoping for?
I think that that's a wonderful way to set the stage for this conversation. And I think that there's what I would love for you to maybe expand on as well is that there is, you mentioned at the beginning, anatomy loads the gun. And within that, when we sort of parse that apart, there are some, I guess we could call it genetic variations or anatomical variances in the shape of the disc, in the way that the facets are oriented. So I just wanted to maybe, just for the nerds that are listening, we have a lot of clinicians that listen to the show. Let's talk a little bit about the orientation of the joints in the spine. When we're talking about the end plate to the vertebra to the next vertebral body, it's not necessarily a joint in the way that we traditionally think about it, but certainly posteriorly with the zygapophyseal joints or facet joints, whatever you want to call them, Z joints, this is more of a, would you say, classic joint, but that orientation certainly changes, and there's a lot of genetic variability certainly with that in terms of the amount of rotation that someone can do, like a certain amount of rotation that someone might be able to do in the lumbar spine. So I wanted maybe your thoughts on or expanding on what you've observed clinically in terms of the anatomical variances for facet joint orientation and then also discs, because your disc shape can also maybe put you at a more or less risk for disc herniation as you've been describing.
You're fabulous. I think you could go back and write your exams all over again from when you were an undergrad and you'd still get A+.
Oh, you've made my year.
Anyway,
thank you.
So to frame this for people, isn't it interesting that if we take a cohort of female gymnasts and we looked at the MRIs of their spine, we would see anatomical features that allow them to be a gymnast. Me, I will never be one, primarily because of the orientation of my facet joints. So people are wondering, what the heck are we talking about? So there's the disc in front, and then 2 facet joints posteriorly, which guide motion. Now, in this particular model, you can see the facet joints are what we call closed. they're orientated like this. An open facet is orientated so there's a closed facet in my body. An open facet would be orientated this way. So for me to be a gymnast and allow rotation, I need open facet joints so they glide as I turn and rotate. That will not rotate. Where's my camera here? That will not rotate. Do you see it? They bind up right away because they're closed. However, you can flex and extend, and the facet joints glide past another. So I can flex and extend with no stress. And if I twist, I create compressive and tensile stress on the facet joints. Whereas if a gymnast with open facets, they need them to twist and have full mobility. A golfer would need them as well. However, if I said to you as a clinician, now I'm interviewing you, what would be a very prevalent disorder in female gymnasts of the neural arch? What are you going to say? Bingo, spondylolisthesis. That's where this bone breaks right here that holds the facet joint on, because when the facets are orientated like this and you bend backwards, they don't slide, they bind up and push. And repeated motion creates a stress crack. And if you keep repeated stress-strain reversals, the crack will sizzle through, eventually get a fracture, and then the superior vertebra slips forward. So isn't it interesting that the anatomical feature that allowed them to be a gymnast is the same anatomical feature in repeated extension that is more vulnerable? And we see this time and time again. Features that give, let's take the lordotic curve of a sprinter. So think wildly here and assume I was an Olympic sprinter.
I'm seeing Usain Bolt all of a sudden. It's incredible. Yeah.
So you will notice that the great sprinters, both men and women, have a lot of lordosis or a hollow in their low back. That turns the pelvis so that when you are sprinting, as the foot hits the ground, if it hits the ground ahead of my center of mass, it's a brake. It's slowing me down. The foot has to hit where my center of mass is and then push from behind. So the actual push in a sprinter is only from the center of mass back. You get a very little amount of time to actually create the propulsive force. But if you pre-turn the pelvis, do you see how I've increased a lot more of the extensor potential? So more lordosis in a sprinter is actually a mechanical advantage. Now let's go to the UFC and look at the great men and women combat athletes. You will find it's quite rare to see a lot of lordosis. You'll see much more of a flat back.
Yeah.
And that flat back pre-turns the pelvis so they can turn around and kick you in the head, but they can't sprint. So do you see what was a great advantage in one particular athletic endeavor was a disadvantage in another? And that's why there's so many different sports. Now, I know what people are going to say. They'll pull out an exception and say, well, wait a second, professor, look at so-and-so. And look, there's always that individual who's been touched by the hand of God. But I'm talking about, on average, these are some of the rules. You will see big men and women. I was with one of the great female powerlifters on the weekend. Heavy skeleton. You will not see a slender skeleton sustaining huge compression. Now, how many big powerlifter type athletes do you see doing sit-ups? And the answer is, I don't know of one. Because if you take a slender willow branch and you bend it back and forth, there's no stress, because it's the thickness, the radial distance from what's called the neutral axis that determines the stress in a bending rod, which is what the spine is. So, you look at the person who holds the sit-up record. Do you think they're a big, strong person, or do you think they have a slender, willowy spine that allows them to do thousands of... Now, how do you think they're going to do under a 2 times body weight deadlift?
Yeah.
Not so well.
Correct.
So, So do you see how you try and match the chronic exposure? Remember, that was the second part of the back pain equation. Anatomy loads the gun, exposure pulls the trigger. Is the exposure now, A, suited to the person? If it is, they will sustain a lot more exposure and remain under the tipping point. If it's not suited to their anatomy features, they have now naturally a much lower tipping point. So the crossing from what is healthful shifts into what is not healthful much more quickly. And we could go through features of every part of, as you know, disc shape, spine thickness, facet joint angle. We're all born with different sizes of neural canals, the size that the
Right.
nerves are in. So a
Yeah.
person, if I was to kick a ball, that pulls the whole neural tract and flosses it through the spine. And then if I reach overhead or I bend forward, it would pull the spinal tract up. Well, some people get friction on their nerve roots, as you know, and particularly as they get older, if they get a bit of arthritic bone growth, that compromises the size of those canals. And then nerve friction and stenosis may start out with being pain, and it may go into motor compromise. They start dragging one foot would be a common example. But anyway, again, I may be going a little bit outside of where you wanted to go here.
No, I love all of it. I love all the tangential conversations that we're going to have today. And Mike, as you were talking, I was wondering, is there a way for the layperson or whoever's listening to this episode, are there any anatomical markers that we might evaluate on ourselves, like, I don't know, iliac crest width or how long our femurs are or something, to be able to sort of indicate, would you say, temperament of the spine? Like what if we're more willowy, or if we're more, better set for doing thousands of sit-ups, or we're more, better set for doing deadlifts?
The answer is yes, but it's not always so straightforward because many of these features work together to create the end product of athleticism and resilience. So it's the full package. But let's start that conversation. We did an experiment with a volleyball team, and the coach said, "Can you help them jump a little bit higher?" So naturally, we thought, well, let's do squats. Bar across the shoulders, high back squat, load carriage, and we'll come up with a I think it was a 6-week, maybe it was an 8-week squat regimen. Half of the players increased their vertical jump afterwards. 30% approximately lost height off their vertical jump, and 20% there was no effect. We thought, well, that's weird. We better do it again. And we did it again, and we got almost the identical result. Then I learned to ask a few different questions. The first one was, I want the team to line up tallest to shortest and name off 1, 2, 3, 4, 5, all the way through to, 14 on a typical volleyball team, something like that. And then I asked them, now sit down on the bench. And the order changed. So what we just identified was body length to overall length, or leg length ratio to body length ratio. Mm-hmm. Now we can get into some squat mechanics. If you have long legs relative to your torso, if you squat, your knees get so far out in front of you, you start getting sore knees. If you did a front squat, that really wouldn't be very good. Yeah. That much more suits a shorter leg, heavier muscled leg, because when you measure the jump mechanics, they use the ankles. They're heavier in the calf, heavier in the quadriceps, etc. When you measure the torque output of the ankles and the knees and the hips of the very long-legged jumpers, you'll find out they don't use their ankles very much. They don't need much calf muscle. It comes from the glutes that extend the hip. The knee goes along for free, but bigger core. Boom. So the hips are acting like a hammer hitting a stone, and they are a back squat versus the jumper with the shorter legs who are much more upright, pumping their knees and pushing with a calf push. So there's an example of just simply the lever ratios throughout the skeleton determines the spine stress, and in fact, the stress throughout all of the linkage. So if you train it a bit oddly, you're increasing probably the risk of more stress concentrations and ruining athleticism. So let me talk about athleticism now, because that squat routine propelled, there was a positive response to the squat program, but there was a negative responder, a 30% negative responder rate. So now we have to get into neurology. I said to the players, are you naturally quick or are you naturally strong? Most athletes know this. And who do you think there increased their vertical jump after the squat training? You got to think about it, right?
Yeah. So the 50% that increased their vertical, I would probably say that they were naturally, so they probably didn't have long femurs, so staying more upright. I would say that they're probably naturally fast.
Yes, exactly. So when a muscle contracts now, it creates force. Everyone gets that. But what they don't get is it also creates stiffness. And when you maximally contract a muscle, you can't move. So this is why athletes are wonderful pulsers. You have to pulse and then release and move. So if you add more strength to strength, you add more stiffness, you slow down, and you don't jump as high.
Yeah.
But for the athletes who are naturally quick and sparky, we all know that kind of person, now you add a little bit more strength and you get an even bigger neurological burst. But it has to be coordinated and timed in the pulse. The strong athlete, there was a term, I don't want it to sound derogatory, but they were sort of the dump trucks of the athletic world. Very strong, very powerful in terms of carrying heavy loads, but they certainly weren't the F1 racers.
Right.
And the fast on, fast off, twitchy, sparky kind of athlete. So, isn't it interesting that to know a little bit more about what is required for performance enhancement allows you to select a better tool? A high bar squat, a low bar squat, or no squats at all. Let's push a sled. Or for the strength athletes, let's relax and just learn how to create more sparky pulses. That will get them to jump higher, not more strength. So that allows us to choose better training tools. And it's that way for every human endeavor. If we can assess the person, we can choose better tools to create both resilience and performance, which I think that's the name of the game for all of us through life.
100%. And you're also just validating my own squat, because I was taught probably, initially, maybe even like you, that the perfect squat looks like this. The chest is up and you fully descend. The chest is tall and proud. And I just can't do that. Like I just hit a wall where if I don't let my chest fall a little bit to allow for my ball and socket and like to stretch the glutes to get down, like I can't get below 90. So I always squatted with maybe what was called a less than ideal. It didn't look like a nice squat, but that's just how my mechanics, that's just how it always worked for me. Whenever I tried to do the hot, like chest tall and proud, and I would always sort of reach this end range where it just felt like I was hitting like bone on bone until I could just sort of fall forward. So I do think that it's important to just, for anyone who's listening, is that there's all these beautiful individual variants, and you have to really understand your own biomechanics to understand the way that you move in order to optimize whatever movement program you're doing. So I just wanted to acknowledge that, because for years I was like, man, I just squat. My squats are so ugly. Like they're so, and I deadlift really well. Like I really tolerated I love deadlifts. And I would say I'm more strong than I am fast. I've always had that sort of constitution. So
the shape of the hip socket is a huge determinant of spine health and performance. So I wish, well, as you know, we've trained, and I'm sure you do as well, train people who prescribe squats and deadlifts and whatnot to choose a style that suits the hip socket. So if you have a client laying on their back and you do a knee probe, you bring the knee up and try and get it to the armpit. If that's as far as it goes for someone like myself, I am not going to be a deep squatter.
Yeah.
But if the knee comes right up to the armpit, and then let's scour the knee around in a circle. And now we determine the width of the squat, whether they're a wide sumo style of squat or a narrow squat or more of an Olympic style, etc. But if they don't, and they're forced to go to depth. So if you're a power lifter, you have to reach a certain depth depending on the league or federation that you're lifting in.
Yeah.
If the hip runs out of room, now the spine has to curl and allow the pelvis to go to sufficient legal depths for that particular organization. And that will cause a lot of heartache. So, those who think there is an ideal squat for everybody will help a few. Unfortunately, they're going to hurt a few. But it's those who realize we have to tune the rehab performance training tool to the individual.
Yeah. Is there a way that the layperson can figure out what our tipping point is for our tissue? Like I've heard you, and you've already said this word, so I will highlight it, sufficient. As we are, and you also, I'll also say, I felt like you were sort of calling me out a little bit when you're like, people don't recover enough. I'm like, oh God, that's me. So there's people such as myself who just love to lift weights. It's my joy. And I, lift 4, sometimes 5 times a week. How do we figure out what is the finite limit of our matter so that we don't, that tipping point that you've described, that we don't cross that tipping point and then the movement now becomes injurious?
It's an art and a science. I wish I had a straight answer for you, Stephanie. It doesn't exist. And I'll tell you why I have that opinion. First of all, there's a spectrum of phenotypes. So to remember the example I was giving you of there's 2 major pathways to disc herniation. One starts with little cracks and fractures, microfractures in the end plate from too much compression. It turns out that that's quite influenced by your parents. There's a large hereditary component to the strength of the plate. So that's one part of the phenotype. The disc bulge story, where the type X collagen comes loose and allows the fibers to delaminate, that's far more dominated by exposure, repeated heavy bending, and it's worse if you have a bigger, thicker, stronger spine instead of a more willowy spine. So if you have a willowy spine, you can bend a bit more, but please don't put such heavy load on it. And if you have a thicker spine and you can bear much heavier load, please back off on the when you're loaded heavy bending and you've just raised your tipping point. But I can't tell you what that was because I just gave you 2 extremes and the variable that determined that. So there's this spectrum of being a human that will always affect the tipping points in all of these systems. So that's number 1. Number 2, the rate that we adapt our bodies is very different as well. Some people, they may not have very much myostatin, and they lift a few weights and they just grow. They swell up. The joke is, well, they're allergic to weights. They really swell up. And that's the way that their body reacts. The next person really struggles to gain muscle mass and strength gains. So these are just things that you learn by being in the game for 40 years, and you develop a little bit of a horse sense through trial and error. But there are principles to it all as well. I gave the example of the volleyball team. You'll learn what kind of features a person has and how they're going to respond. So that's about as good as I can tell it. Don't get greedy with strength gains. So there are those people, they come to the clinic here, and as you know, I retired 10 years ago now from the university, so I'm not producing new science anymore, but I still see patients here at the clinic. I lost my train of thought now. It was something to do with...
You said don't get greedy with
strength gains. Yeah. Thank you. Sorry. It's white hair and getting
That's okay.
older.
No, I actually love that. That is a quote for sure. Yeah.
Yeah. And when I look at the great ones, and as you know, I specialize really in elite athletes. You take someone like Ed Cohn, who's known as being the greatest of all time in powerlifting. People don't realize when Ed set a personal best, he would say, okay, I'm going to take 3 or 4 months off now. Allow my body to adapt to that new maximum challenge that he just went through in his body. And then he might get another personal best in the year. But look at the average duffer who comes in. They've just got one personal best, and you name the exercise, whatever it is. Say it's a deadlift. Oh, I got to get my next personal best. And I said, what are you thinking? Why don't you take 4 months off? When Brian Carroll set the world all-time squat record, do you think he went back and he squatted 1,306 pounds. Do you think you can train a
Jeez.
squat? He
Yeah.
was shattered neurologically and physically for weeks, maybe even longer. You've got to let your body adapt. So the higher the closer you get to your personal best, unless you're an absolute weak kitten. I'm not talking about that. But if you gain a certain amount of resilience, it's pretty hard on your body, and it takes a long time to adapt to that new level of loading, shall we say, to build the tipping point. So now the tipping point is above and beyond what the last personal best was, plus a margin of safety. It takes time.
Yeah.
Muscle will be a little bit faster. Those who are on supplements will build muscle really fast, but the connective tissues are nowhere near keeping up.
Yeah.
Women who are a little older now, it's debatable whether some really have the ability to grow bone. Their challenge is just to maintain what bone they have. And as you know, the greatest time for osteogenesis for a woman to really build bone is when she's a teenager, when she's 15. I hope they're working. I hope now you're going to set me off onto another thing now where mom's driving them to school. And,
Yeah.
really, people are going to hate me for saying this, but taking away their future health by not stressing them in the very age that they need to build good massable bone. That's the best time
Or
they can do it.
dieting. That's the other big thing with
Of
teenage girls.
course.
Is they're dieting down. And it's like, you cannot be in a calorically restricted state right now. This is where you're setting up the foundation for your life. You can't change it.
Thank you. Huge. Beautiful.
Yeah. Okay,
Yeah.
so let's actually talk about this idea, because this is something I was actually saying to my producer before he was like, I think you've been thinking about this a lot lately. And I have been. I love the idea of muscle preservation, sufficient strength, to use your vernacular. But I also think that you can't age well. So when we think about aging well, aging powerfully, you can't age well if you don't have good joints. Like if you have a bum knee, you can't train your quads, hamstrings, or glutes. If you have a bad spine, you can't do anybody who's ever had any type of low back pain or back pain in general, whether it's cervicogenic or thoracic, whatever. If you don't have good joints, everything else falls apart. Like I've often referred to the skeleton as like the scaffolding. Like if you don't have a strong scaffolding, everything sort of falls. I would love for you to react to that thought, and if you agree or disagree, and then expand on why.
You're really getting to the heart of the matter in several of these issues, Stephanie. If I can say, you're quite impressing me. This is fantastic. There is a trend right now in the longevity world that you should be getting stronger, maximally stronger now, to preserve this as you go into your old age. Well, I'm old enough now that I've watched myself and a lot of my colleagues and a lot of the patients over the years go through their life cycle. I've also done studies on different cohorts of athletes. I've done studies on occupational cohorts. I'll give you an example. We followed the Toronto Police Force ETF, the Emergency Task Force. That's the SWAT team. These are the guys who are doing heavy policing. They train in the gym almost every day. They rappel down buildings. They do a lot of physicality. Let me ask you a question. Where do you think, I'm asking you too many questions, maybe that's not fair, but where do you think the most dangerous place in terms of injury is for an elite police officer?
Ooh.
I'll lead you a little bit.
Yeah.
It's not out doing dangerous policing. It's the weight room.
Oh, I'm sorry. I misunderstood. I thought you were asking me which joint, and I was like, I don't know.
Oh, no,
shoulder?
no, yeah,
Okay,
no, sorry.
Okay.
It's, by the way, it's low back.
Low back, okay,
It's the number one joint
Yeah.
that is coming. No.
Is that ego lifting? Is it the ego lifting?
Yeah, you just hit the nail on the head. Do you think it's
Yeah.
the most fit or the least fit who are hurting their backs the most?
Probably the least fit.
It's the most fit.
Oh, it's the most fit. Okay.
It's the most fit.
Right. Because they get a PR and they're like, oh,
yeah, on a cardiovascular measure, right?
Mm-hmm.
They're the ones who are overtraining. So maximum strength will not get you through, on average, to your golden years with good joints. Sufficient strength will. So that's a huge leap in understanding. If you train for sufficient strength, sufficient cardiovascular resilience, sufficient mobility, not more mobility.
Right.
Sufficient. That will get you through with more intact joints. But if you are, the stronger you are and the more you push personal bests when you're in your athletic prime, the shorter your athletic prime will be. Now, again, people are going to say, oh, well, what about so-and-so? I know. Those people won't be you. Those are the ones who've been touched by the hand of God, as I've said.
We can't all be Ronaldo. We can't all have like a 40-year
Well, let's see how I love his athleticism, but let's see how he is when he's a little bit older, because we here have lots of ex-NHL players, combat athletes, footballers. Most people wouldn't want to be them. Yeah. So anyway, my point is, I think there might be a little bit of a myth right now that getting really strong will give you a great retirement. I'm asking people to save their joints, and they will have more ability because they will not be able to do some of the things like lifting up their grandchildren, getting down on their knees and playing with them on the floor. Yeah. It's no fun with artificial knees and artificial hips.
Yeah.
And keep your joints healthy. Keep your end plates healthy in your spine. And people say, what are you talking about? Don't lift excessively, just modestly. And in our experiments show this, and my observations of cohorts of people now for getting on for 5 decades support that as well. So I don't know if that's what we can talk about, how training should change through the lifespan as well.
Yeah, I think that's a wonderful place to go. I'm so happy that I'm thinking, at very least, thinking along the same lines as you, that you are in agreement to that. I think that we have a new t-shirt now that we have to wear to the gym, which is don't get greedy with strength gains. We should be wearing that to the gym to remind ourselves to preserve the joints at all costs. The other point.
Well, I think don't get greedy with the rate either. Slow down. I'm in a hurry.
Yeah, I love that.
I stole that from a great athlete, by the way. Slow down, I'm in a hurry.
Slow down, I'm in a hurry.
Yeah.
My mom used to have this little magnet on her fridge. It was like, God grant me patience, but please hurry. Like kind of the same thing.
Yeah, exactly.
The other comment I wanted to make was just around movement diversification. So, we've been talking about like getting into the gym, maybe the elite, like the Toronto ETF, like their SWAT team. It's the most advanced. It's the ones who are the most experienced in the gym that are injuring themselves maybe at a higher rate than maybe the newbies, because the newbies are maybe being more careful.
I didn't say that.
Oh, I'm sorry.
Redirect me. I didn't say that. I said the ones who are training harder.
The ones, okay, yes, thank you for that. Yes, so the ones who are training harder are the ones who are getting more injured.
Right. May I just take 20 seconds?
Please.
Step change in your training, whether you're a newbie or an oldie. A step change instead of just a little increment greatly increases your risk of injury. You've used up the margin of safety now between where you currently are and where the tipping point is. Your training is supposed to keep moving the tipping point up. But if you take a large step input, you go right to the tipping point and butt up against it and maybe even cross it. So do you get what I mean by that? And
I do, yes.
That's what happens with newbies. They create gains in the gym too quickly and not staying at a certain level for a period of time to allow the full spectrum of their support systems to catch up.
And the step change would be defined in terms of volume, in terms of weight, in terms of frequency, in terms of intensity, all of that.
So a general rule of thumb, it's called graded exposure.
Yeah.
So you want to, some people, I remember being an undergraduate like you, and it was the 10% rule. Remember that? You only ever increase your training load by 10%. We followed a great athlete last year. I was on the medical team for this athlete. They had 3 injuries. Every single time of those 3 injuries, the week before, they had more than a 10% increase in their training load. The weeks that they just went 10% in they might start out with a strength phase for 2 months and then taper into a speed phase or whatever. But whatever they did, the weeks that they violated that 10% rule, the subsequent week, injury. And, we've been doing this for years. It's generally a pretty good rule of thumb. Now, some people might be 10% per month. In the beginning, they might be able to get away with a 10% increase. Like, say someone's coming back from a back injury and they really want to ride their bike, but it was flexed out over a bicycle frame that was irritating their disc. Okay, so say you've gone through some good rehab, the hips are free, they've got a good stability profile around their core, etc. And now they want to get back to their love, which is on a bike. Go ride 5 minutes. What do some people do? Oh, I felt so good. I didn't have any back pain. I went and rode my bike for an hour and my spine blew up. Good. You created it.
Right.
Versus, slow down, I'm in a hurry. Go ride a bike for 5 minutes. The next day, don't ride your bike. You're simply auditing. How does my back feel? How do my hips feel? If they feel good, you got the green light, but do not do any more. That's the day to adapt to the 5-minute success. The next day, add 10%. We'll say it's six minutes. So everyone knows what compound interest is. You start off 10% gain, but boy, 10% interest, does it ever start to take off after a while? And so will your pain-free, resilient, sustainable athleticism. So,
God, I love this. Yeah.
Yeah.
Sorry.
Anyway,
I was
you get the idea.
Yeah. I love that. And I what I was trying to express was that I think that there's value, and again, feel free to redirect me and weigh in with your opinion around this. You just talked about compound interest. Like when we think about like an investment portfolio, like a financial portfolio, usually one that is very diversified usually mitigates risk. And in the same way, I feel like if we have a diverse movement program, so if someone really loves the bike, using your example, when we come back to that sort of biocycle social, like it's like, oh, if I don't do the bike, I'm going to kill my kids and, murder my husband. But is there something else that we can find that has a slightly different movement pattern that can still give you the same, joy, happiness? You feel like you got a sweat on, you feel like you've, relieved your stress. Because what I'm noticing, and my, friends of mine who've been doing the same, like they love to mountain bike, and that's the only thing they will mountain bike for hours and hours or whatever, or they're only doing deadlifts in the gym. Like that's the thing that they love to do. Their bodies are wrecked. Like they are wrecking themselves. So is there value? And this is my own, I'll sort of just share a little bit personally, is one of the things I've added on this year is more Pilates, core work, pelvic floor integrity. And then my husband and I have taken up tennis. So this is very different than weightlifting. I used to be a sprinter, so I used to like run many, many years ago, but like that lateral, like moving in the coronal plane very quickly, tracking the ball, getting the swing, all of that is a very different movement pattern for me. And that's sort of what I'm I think about more and more as I'm aging is like, what are some of the different ways? Can I have just a mobility like, can I just be, is there a time whether it's gym or home or wherever, where I'm just working on mobility, or I'm just working on core stability, or I'm working in the coronal plane because I don't get like that side to side movement because I don't get a lot of that in my everyday life. What have you thought of that? So is there any opinions or thoughts that you think about as I'm describing this in terms of the value of having like a diverse movement portfolio?
That was a great introduction. I have two major thoughts. The first one, let's call it movement literacy, a broad understanding and capability of balance, moving in a way not to create stress concentrations in a single part of your body, incorporating lateral forward movement. When you were younger, what was your greatest risk? Well, it would have been based on your sports and that kind of thing. But when you get to my age, you know what my biggest risk probably is, and certainly of my colleagues? Falling.
Falling, yeah.
It's all changed.
Yeah.
Do I have the hip flexion power that when I stumble on the sidewalk or catch my toe on a tree root or something in the woods, can I get my hip to flex quickly to get my foot out in front of me to arrest the forward fall of my center of mass? Now, I have to get the foot ahead of the thrust line of the falling center of mass. If I can do that, I arrest the fall and I don't break my wrist or my hip or whatever. So that movement competency and literacy changes throughout your life cycle because the risks change and the various diseases associated with poor movement load, which would be something like diabetes, would be an example of an under-moving individual. Anyway, so my bias on all of this is we don't really want to emphasize unidimensional athleticism when kids are young, playing one sport. Let them develop a literacy and a competency doing a lot of different things, and they will find their own combination of things that suit their body and that they enjoy, and the chance of it sustaining is much greater. And I would also say we return to that as we get a little bit older. So that's my first evidence-based and experiential opinion. The second one was, and if I just look at my own history here, when I was younger, I like most young men, you strength train. I didn't need mobility. God gave me mobility. I had, pretty good wind and cardiovascular ability. Just, you play a bit of hockey and, but strength training, you look a little bit better and you feel a bit more virile, shall we say. But now I'm a little bit older. I've developed, or I don't want to say I developed this, but it's what I've gravitated to. Do you want me to talk about the Biblical Training Week?
Please, yes. This is my lead into the Biblical Training Week. Yep.
Okay. So at this stage of my life now, I'm not interested in heavy strength training. Frankly, my joints won't take it, and the joints of my colleagues won't take what we used to do as young men either. But I'm looking for a sustainable athleticism and literacy that will allow me to do everything I want to do. I still work physically. I live a very rural life, and I want to keep that going for as long as I can. So the Biblical Training Week, there's 7 days in a week. Every major religion has a Sabbath day, 1 day a week. And I remember growing up, my dad was not really a religious man, but you didn't work on Sundays. That was your day of rest, and you fuel and rest. And what a clever thing that was scientifically for the body. Any little ache and pain, just let it settle and adapt that 1 day. The remaining 6 days, 2 days a week, strength train. 2 days a week, mobility train. 2 days a week, challenge your ticker, your cardiovascular components. So the next rule is don't do the same thing 2 days in a row. So if I strength trained yesterday, I've got a choice. Today it'll either be a mobility day or I'm going to go out and do cardiovascular. I'm going to go for a ski. I'm going to ride my bike, a swim, whatever it can be. But tomorrow I've got my firewood to start preparing. That is checking all 3 boxes. Now I can't split firewood all day anymore because I would be sore the next day, but I can split wood for half a day still. So I just checked all the boxes. That gives me a free day now. The following day, I have to choose one of the 3. But it systematizes that I'm going to challenge my systems, but I've organized it so that by the end of the week, I've got a little bit of interval strength training, a little bit of interval cardiovascular, and a little bit of mobility. So we've accumulated a little bit of mileage on our bodies. I've got an artificial hip. I've been banged around a little bit and had some fun doing so. But my point is, I have to do a little bit of mobility for my neck, a little bit for my shoulders, a little bit for my hips, etc. And I feel better for it. I do it very strategically. So, after this podcast, I will probably unleash my psoas muscles and do a little bit of very targeted hip flexion, psoas stretching, through the full fascial chain, extending my left hip, pushing my left hip to the ceiling, pushing my heel up to the ceiling, spinning around, and you can feel the psoas tendon through that fascial chain being modulated by that elastic chain, shall we say. So, I'm at BackFit Pro HQ here. Yes, we have all sorts of belt squat machines and standing hamstring, sitting hamstring. We've got a strength rack back there, cables, an exercise bike, rowing machines, Roman chairs. I can get a lot of work done. Anyway, my point in all of that is my training changes every day based on the previous 2 or 3 days under that overarching guideline of the biblical training week. Stephanie, I feel fabulous. I'm fitter now in many ways than I ever was when I was working and in the harness, so to speak, of having to go to the university every day and sitting in meetings and very unhealthful things like that.
I think that and it's genius because as you change the activity from day to day, you're also recovering from the activity that you were doing the day before, so that by the time the 3rd day comes around, you're actually ready to repeat that motion pattern again. So I love that, and I think that it's an important take-home point for anyone that's listening is I don't think recovery, you said it earlier in our conversation as well, I don't think that people prioritize recovery in the way that we should. Certainly, achievement-oriented types of personalities, such as myself, I will call myself out on that, is sometimes it's hard for me to rest. It's hard for me to say, no, actually, I need a break. So I typically follow more of an asynchronous split, so I can kind of have I can sort of check in and say, okay, actually, I'm still sore from legs 2 days ago. I still need another, day or two. So I don't have, it's not like Monday's legs, Tuesday's back. It's not that stiff. It's a bit more fluid based on my recovery. But I love what you're describing here because you can do full body work, like the chopping of the wood or, whatever it is that you're doing on Monday, let's say, and then Tuesday, if you're doing mobility, you're recovering actively from the stuff that you did on Monday. And then if you're doing some cardiovascular work on Wednesday, whatever that might be, then by Thursday, it's like, okay, I'm fresh. I can come back to, chopping wood again, or I can come back to the strength or, whatever the, the movement is. I think that that's important because that movement, if I can use my word here, like the movement diversification is keeping you, I don't want to use the word young. I don't think that's the right word, but I think it's preserving all types of movement rather than just selecting for one. And you said something really important with kids. My kids both play competitive soccer. So of course the inclination is to just only ever do soccer. And it's like, nope, you're doing tennis, you're doing running, you're doing all these other things, you're doing mobility work, because if you only teach them one way of moving when my kids are 14 and 12, that's really going to stick with them, when they're 25, 35, 45, 55. So I love, love, love that you said movement diversification or different movement patterning for kids as well, like not to just stick them in one sport. And at least my understanding is most professional athletes, never really specialized until they were sort of in their late teens anyway. Like there was a couple of different things that they were sort of working on. And then, at some point decided I'm going to be an Olympian. So I'm just going to focus all in this particular category. Would you say is that true, would you say, or something?
I know too many athletes who violate that, but again, my
Yeah.
athletes are not a great bunch to mimic.
Yeah.
They are all
Yeah.
very special. They are a little bit weird. They're a little bit, they're different. Some are incredibly asymmetrical. I don't know of a symmetrical baseball pitcher,
Yeah.
but they are a little bit odd on the human spectrum. That's what makes them so exceptional, and so that they can do things that other humans can't. Some have been incredibly unidimensional in their athletic life, and some have been incredibly diverse. So yeah, but I will go with the average person as the person with a diverse, shall we say, exposures and stresses to their body that are more robust as they age. They don't wear out a single component. But you said something earlier. You mentioned Ronaldo. There's a fabulous documentary of Ronaldo, and I don't know if you've ever seen it, but they measured. I'm going to back up. When we have an athlete come in here from a sport that we may not be fully familiar with, we work with the coaches, we work with them, we look at game films to write down what are the critical demands of that sport. Well, that sport requires hand grip. That sport requires a deep squat, etc. And we write down all those things that are critical to performing well in that sport. And then we go and test them in the athlete. And if they can do it, great. But if they're struggling with one or two, we just identified our training targets. Do you see how we organize sport-specific, athlete-specific training?
The test becomes the program.
Yeah. Well, the failed test does.
Yeah, the failed test, yeah.
But as long as they're orthopedically sound. Otherwise, we have some primary rehab, and we'll probably send them off to you to do that. But anyway, so going back to Ronaldo, they went through the critical elements demanded of soccer. So an all and out, straight ahead, 30-meter sprint. Changing of direction. I don't know if you saw this, but they did a corner kick. Ronaldo was in front of the goal mouth. They had someone corner kick the ball through the air, and then they turned out the lights. So you couldn't see the ball. Most of the players that they put in the goal mouth went like this because they didn't know if they were going to get hit by the ball. Ronaldo, even though the lights were out, he'd already studied the trajectory, and he was able to either head the ball or kick the ball into the goal.
Unbelievable.
So when they compared them to his peers on that particular essential skill to soccer, he was light years ahead. They then went to, you don't run 60 meters, you don't do a 100-meter Olympic sprint in soccer. You do maybe 20 or 30 meters. So they took Olympic sprinters and Ronaldo, and they ran 30 meters. Do you know he won and beat almost all of them? And then they did directional change around cones.
Yeah.
Guess who won again?
Yeah.
So anyway, my point is, know the essential demands and train those, and they may or may not come from your particular sport. So if you have kids and your kids want to be great soccer players, consider A, what they're good at, B, what they need, what are some of the critical elements, and you'll find that some of them they're not training at all, and they'll have a lot of fun challenging themselves to get better at some of those things.
This is something that I've thought deeply about it, and I don't know where I stand on it. So I'll just say the thought, and I'll say the problem that I've sort of muddled on, and maybe you can provide some clarity. And that is around weaknesses. So sometimes, if I've had a patient in the clinic, let's say, or even just in my own personal life, I identify that there's a weakness with some movement pattern or, movement literacy, to use your vernacular, which I love. Do you lean into the correcting the weakness, or do you try to profit off of what you're strong at? And so I think the answer is it depends. But I would love to just throw that idea out at you and see what you say.
I deal with that very often. And I know this is quite a controversy in social media and et cetera. You've hit the nail on the head. It depends. So let me take, an example that comes to mind is a great combat athlete. He actually competes in the UFC. That's a mixed martial arts organization if you know them. He is quite flexion intolerant, and he's got a fair amount of joint instability. He's getting micro movements in shear at the bottom of his lumbar spine. He's an excellent jiu-jitsu master, and that involves if your opponent is on top of you, which is an awful place to be if they're hitting you, he plays guard, as it's called. He wraps his legs around the opponent, locks his legs, and tries to control them. Mm-hmm. But in order to do so, he must round out his back and get his legs around the opponent. Heavy spine flexion. But I just told you that was his spine trigger. And if he has an acute attack in a competition in the UFC, he's going to the hospital and things aren't going to work out very well. It's a horrible, horrible place to be. He cannot train that in the gym because if he does, he keeps himself tenderized and vulnerable to that keep repeating as the injury. He must avoid it to gain some resilience. But then people will argue with me and say, oh, no, he does it in the UFC. You got to train it. And I'll say, well, that hasn't worked out. It doesn't work out with a lot of our athletes because they become injured very quickly and almost right away. So it's a non-starter now. They can't even start to training if you keep exposing them to that very vulnerable athleticism. So let's train around it, avoiding the trigger. So instead of rounding out the back and twisting and keeping training that, which we know they're going to blow up right away. If I could show this, I'm going to take my earphones off for just a minute, and I'm going to keep on talking, assuming that you can follow me here. So actually, I have a long enough cord. So if I got into a lot of flexion like this, I'm going to really risk triggering my back. But if I went into a side plank, lock it in, and I rotate, keeping my rib cage and pelvis together, I come around, tap my elbow, come around, tap, tap, tap. I can get very quick and very proficient in pulling myself into safety. So you see the philosophy. You're training great power to maybe broach into that injury mechanism, which they're very vulnerable to, and you can pull back into great strength immediately, shrimp out of it, roll into an opponent, etc. So there would be an example where do you train it? It depends, but we've had enough success, and this is a highly decorated UFC person, by the way. We've proven it enough times with validity of getting their arms raised at the end of the fight. Don't train it openly. Be more clever. Teach them to get out of that vulnerability with great power and discipline. So does that give an example of a philosophy to use a principle to avoid some of those, do you go out and add more mobility when you think you need it for the sport? But veterans are a bit more cagey and tricky.
Yeah. And this brings me to, actually, we were talking about this right at the top of our conversation, which is proximal stability. You've talked in back mechanic around this idea of the big three, and you just demonstrated one of them with movement, a dynamic example.
Not very well, probably. But
no, it looked great. I want to talk about the big three. So bird dog, which I'm just going to tell you, I see on the internet is not done well at all. It's awful. Side plank. And then just talk about talk a little bit about why these are important for the integrity of when we're thinking about that proximal stability, when we're adding stability, that core stability that we've been talking about, that coordination, and even how, I've heard you talk about bird dog and how you can even sort of progress that a little bit and like kind of move the arm, opposite leg, even a little bit out to the side, and kind of progress it that way. So talk a little bit about the 3 exercises, what they are doing, and then what their application is.
All right. Let me give some context to this. Years ago, we would measure spine pain triggers in patients, and here's a very potent one. This joint here has lost a little bit of stiffness, meaning it's slightly unstable. Let me show you what that means in real life. I'm going to apply a torque to the top of the spine. Do you see that the majority of the motion is occurring at the joint that has been damaged? This one's intact. This one's intact, but watch this one now. Look at that. So when this person lays in bed and see how that cocks off to one side, they get an ache in the left side. They roll over onto the other side. It's so unfair. Now they get an ache on the right-hand side, and they don't realize what the mechanism is. If they put a little bit of a folded towel, perhaps, to align their spine to avoid that micro movement in shear, they wouldn't get the ache. All right. How can I restore stiffness to the joint and arrest that micro movement? Build a muscular girdle around it. So then our challenge was, I didn't create those exercises. We measured them for their ability to spare the spine, because the spine doesn't have a high tipping point. It's just got a small, narrow region that it can train pain-free. But we have to challenge the front, the side, and the back of the core to guarantee stability, train the muscles isometrically, and not cross the tipping point, spare the spine. And what bubbled up to the surface was what we called the big 3. So the magic of the bird dog is on the upper spine on one side, just the right side is active, and on the low back, the opposite side is active. So we got a cross-training PNF style of muscle activation, but it's only half of the spine load. Not both sides of erector spinae in the thoracic and the lumbar are active. Only half of one. So it's half the spine load. You can't do this laying on your tummy and doing a Superman, because that forces the spine into hyperextension. That will cause back pain in a lot. So when we can get a neutral spine, we've increased the tipping point, or the tolerable volume. Bingo. Perfect. So that was the magic of the bird dog. But again, how many McGill videos are there on the internet of people
hyperextending
their leg? No, but I'm not out there showing the bird dog. And the reason is I designed the bird dog variant for every single client. There is no perfect bird dog. And yet all of these guys on the internet have taken our work and bastardized it and say, oh, this is the perfect bird dog. Son.
Sit down.
Sit down. Go back to school and learn your gear. But if I was to do a bird dog, I can play with my spine and find a resilient position. I can lift. I'll do it on this side so you can see. Some people, they lift the leg. Watch my back. I just lifted my leg with my back. Versus keeping my back a battleship. I push my leg out behind me. I push my heel away. Now I just transferred a core proximal control. I'm holding my leg with my glutes and hamstrings. How perfect is that? Now, opposite arm, I squeeze my hand. I lock it in. With my stance hand, I'm going to pull my hand down to my feet. Now I can engage all my latissimus structure on this side if I have the tolerable volume available. Now I lock that in it, and then people say, oh, that's not much of an exercise. Well, you do it that way and put some beef into it. And then we can do all kinds of motions about the ball and socket joints, drawing squares, putting in pulses, whatever the appropriate athleticism is. So there's an example of just a simple bird dog, and we're morphing that into the best combination to meet the goals of that person staying underneath their tipping point. But that challenges the back musculature. liberates the ball and socket joints, etc. The side plank turned out to be the best combination for targeting the lateral musculature. If I'm on my left elbow, just the left side of my lateral musculature is being challenged. But look at quadratus lumborum. A fabulous spine stabilizer is challenged, the psoas and the oblique musculature. The other side, not so much. And then other people will turn it into what's called the star. They raise the other leg up, not realizing you just doubled the spine load. Well, if someone doesn't have available compressive capacity, you've just taken them to pain. So do you see why there is no perfect side plank? It's perfect only for that person in that particular phase of their rehab or training cycle. For the front, well, a push-up would be a pretty good anterior core beginning challenge. A rollout is 100% activation of the rectus abdominis, but instead we do a modified curl up for most people. Lay on your back, put your hands, palms down under your low back, just lift the head, neck, and shoulders. We may lift the opposite arm. We may do a variant of a hip thrust or a one-legged hip thrust as an example. But my point is, we chose variants of the big three to create this isometric core control. Then along came, we knew this worked, by the way, because we trialed it with NFL football teams. We found that they could train a little harder. And then Keith Barr, who's a professor in California, he's quite popular now on shows like Huberman and Peter Attia and whatnot. His area of expertise is in collagenous tissues. And he's finding that isometric exercise in almost identical ways that we prescribe it, 3 10-second holds would be a starting training block for a bird dog, for example, squeezes the inflammation out of the collagenous tissues. Rest.
Oh, he's the tendon guy, isn't he?
Yeah.
Oh,
yeah.
Yeah.
And what's the most effective? Isometric 10-second holds.
Yeah.
Exactly what we've been doing for almost 40 years.
Away. Yes.
Keith's fabulous.
Yeah.
So, there's something that I never understood. I knew we were able to create unique clinical success with it because, remember, we were measuring the score. But I had some ideas on, well, is there a neurological holdover? In other words, there's a stiffness there. Now, we measured that. When you do the big three, you add a little bit of stiffness, and stiffness isn't a bad thing. People hear the word stiffness and they think, oh, that's something to be stretched away. What I'm talking about is the material property of stiffness. So this nerve has the property of mass. This nerve has the property of stiffness. So if it didn't have stiffness, you'd pull it apart. So it's only a material property. But if we can add normal stiffness back to that joint, we've arrested out the painful micro movements. So stiffness is only a material property, but it has to be tuned. It has to be tuned to be not too much, not too little, appropriate to proper mechanical behavior of that joint. So doing the big three created a stiffness to arrest the micro movements, and it allowed the spine, which is a flexible rod, to bear more load before it buckled. And we were the first ever to watch a spine buckle during a deadlift in powerlifting as an injury mechanism, for example.
Yeah.
So it's been kind of fun. I stopped producing science 10 years ago, and it's allowed me to watch a lot of this unfold with my colleagues who have quite different expertise. Tim Hewitt has been a fabulous biomechanist and probably the premier at women's ACL injury avoidance. And some of Tim's tests on NCAA female basketballers, you stand on a box and you land, and if the knees go into valgus, that's a very
good indicator.
Potent predictor of ACL injury. Well, then Tim ran trials. He would train teams to become core controlled, gluteal dominant, so that when they land, the gluteals externally rotate the hips and the knee goes where the hip commands it to go.
Yeah.
So if you can drive it through the glute is one of the best ACL sparing mechanisms.
Preventers, yeah. And meniscal tears too. Yeah, totally.
Sure.
Like medial meniscal for sure.
But isn't it interesting that Tim's program for the knee turned out to be the same preventative program that we found for the spine? Things started to come together a bit.
I love that. I love that. And so what I'm trying to, obviously this is just gold. This is just amazing. And I know that there's going to be listeners who are like, okay, she's talking about everyone has these anatomical variants. So someone might be able to extend their leg a little bit more without increasing the lordosis or without lifting with their back, let's say. So how do we, this was certainly my experience in practice that even the same principle had to be tailored to the individual patient. And so how do we get this information? Obviously, you're not practicing, you're not seeing clients anymore. I know your time, there's only a finite amount of, we have finite limitations of our matter. We also have finite limitations on our time. How do people get the individual nuances for their own bodies? If they want to say, if like you have a middle-aged woman that's listening, she's new to the weight room, maybe, she's hearing this, she's like, okay, I want to sort of balance strength. We want to have that sufficient amount of strength, sufficient amount of muscle mass, and balance that with the literacy that you were talking about, balance, the stress concentration, lateral movements, hip flexion speed. How do we get her to do the bird dog that's right for her, or the side plank that, at a certain, positioning that's right for her anatomical variances? How can people find that out without, what are the resources that we have?
I hear you loud and clear. That was my challenge and continues to be my challenge. I do still see patients, by the way. The problem is I'm limited, and I usually see the ones with higher athletic demand these days. However, if you go to our website, backfitpro.com, you will see our certified clinicians around the world who I've taken our courses, but I haven't worked with them personally. And then we have our master clinicians who I have worked with each master clinician personally, and I'm confident in their abilities to help people with some pretty involved back pain mechanisms. So if a person really wants to have that personal guidance, shall we say, and some tricky decisions being made, I can recommend one of those people. I don't want to sound too self-serving, but there's my big, heavy clinical textbook, which you read in
low back disorders
in school. I wrote Back Mechanic for the lay public for these reasons.
Yes.
However, Back Mechanic was intended for people who have back pain, and they're trying to create strategies to get out of pain and create just a base resilience. That's read Back Mechanic, follow the self-assessment, and tune your program accordingly with the book. When they want a little bit more athleticism, I then wrote Ultimate Back Fitness and Performance to propel their athleticism in following some of the principles that I'm describing to you now. So that's been my way of dealing with that, but it all comes from me being a back pain specialist. I've got colleagues around the world. Let's say one of your listeners is a woman who really, their thing is yoga. Okay, Bernie Clark is a good colleague of mine, and Bernie wrote Your Spine, Your Yoga. He wrote another book, Your Body, Your Yoga. And what Bernie did, he cites us all the way through it. He would assess the woman who's interested in yoga through a few asanas and use them as tests. If you can only go to this point in that particular pose or asana, you go on that side of the room. But if you can go past that, you go to this side of the room. This side of the room will do this. This side of the room will do that. In other words, he's tuning the yoga to make sure they don't cross the tipping point.
Right.
It's automatically incorporating their joint structure, their anatomy, shall we say, their current tipping point, their level of skill and proficiency. So I also, as I specialize in elite athletes, I work with different coaches around the world who I trust. We've had many successes in professional sport. So depending on the sport, my role is to get that athlete out of back pain and to build a base resilience for their sport. Will it get them back to playing with the New York Yankees? It might. Chances are there's going to be some fine-tuning. Or another one would be getting them back onto the PGA Tour. So if I can build a base ability to swing a golf club, but boy, you got to drive a ball 380 yards into a bucket time after time again. So you need some consistency, etc. I work, say, on the PGA, I'll work with Ben Shear, might be an example, Ben Shear Golf. So I'll send that player off to Ben, or if Ben has a player who's struggling with back pain, he'll send them back to me. They go back and forth. If it's baseball, I'll work with Eric Cressy, who's an elite baseball trainer. Is he the best in back pain? Is he as good as me? I'll tell you right now, no. But am I as good as him in preparing an elite baseball player? I'll tell you again, no. Cressy's better. So I have my colleagues around the world for different sports, MMA, American football, getting ready for the combine, etc. So that's our team around the world, and how I try and deal with that question as you posed it.
Okay, well, we'll make
sure
they
can start with our website, BackFit Pro, and they'll see those various individuals.
Yeah, so we can make sure that those are links in the show notes. Certainly highly recommend Back Mechanic. It's, when I was in school, it was when you're thinking about diagnosing a patient, you would like the moniker, the acronym is like low doctor for care. It's like location, onset, duration, frequency, intensity, characteristic, like all of these different questions that you would ask the patient in you don't have to remember that moniker, but this is the doctor in your hands to help you really pinpoint where it's coming from, because this idea of non-specific idiopathic back pain, I don't subscribe to it. I know that you don't. And so the book is a really good way to get to sort of the root cause of what is happening. And then of course, if after you read the book, you can go to your website and find these clinicians and coaches that you're describing. But everyone should pick up the book, I would say.
Well, all I can say is there was a need, and that's why I wrote it.
Yeah.
I needed another activity like a hole in the head, but that's why I did it.
Dr. McGill, I have to say this has been a highlight of my career. I was studying your book when I was just a little pasty white chiropractic student, just in awe of everything that you've done for not just the chiropractic profession, for anyone who has ever put their hands on a patient. I can't thank you enough, and you're one of my heroes. So this has just been such a wonderful full circle moment for me. So thank you so much for spending the time, your focus, your energy, your presence today. I'm truly grateful.
Stephanie, I should say Dr. Esteem, and I should be a bit more formal, and I don't mean to be disrespectful. I'm trying to be more respectful, but thank you for all the work you do. It's fabulous leadership, and it's so needed. So thanks for all you do.
Thank you very much. Okay. Can we just take a moment? I need a moment. Dr. Stu McGill, goodness gracious. I am almost at a loss for words right now, because this man has been I literally looked up to this man. He was the guy when I was in chiropractic school. Oh my gosh. It's just like a full circle moment for me. And I am so, so, so happy to have been able to have this conversation, and of course to share it with you. I realize that my nerdiness may have gotten the best of me, and this may have been just a slightly dark roast Betty episode where we were talking about zygapophyseal joints and, proprioceptive neuromuscular facilitation. And he was like, PNF. I'm like, oh yeah, PNF. So I know that there's a couple of big words in there. I will try to help out in the show notes wherever I can. And certainly if you've listened to this on audio, you definitely need to go and listen to this on YouTube. So a couple of my favorite moments. Actually, I'll say overall, I love how Dr. McGill gives 0 Fs. He's just like, this is the science. This is what works. I've been doing this for 40 years. I know what I'm talking about. So I'll just say that I loved the idea of sufficient stress, and that maybe we are getting a little bit greedy with the strength gains. And I understand that we want to put on muscle. I want to put on muscle. I want to preserve my muscle. I want to make sure that I'm strong and I'm powerful and I have enough muscle to grace my older years. And we don't want to do that at the sacrifice of our joints. So I think we have a t-shirt now from this. Don't get greedy with your strength gains too fast. I think we need to all be wearing this to the gym going forward. And then really thinking about how do we preserve our joints? How do we revere and honor the joints? Because when the joints go, everything else goes, right? The other thing I'll say, I had a little moment of vindication. Okay, so I have been criticized so harshly online for saying neuromusculoskeletal because that's how I was taught. I don't know if that's just my Canadian showing, but neuromusculoskeletal. But I've had literal people on YouTube, they're like, you don't know how to talk. How am I supposed to take you seriously? And Dr. effing McGill is like, the neuromusculoskeletal? I'm like, yes, tell me, doctor, tell me about the neuromusculoskeletal system. So, okay, so joints, proximal stability, and sufficient stress, I think are the big takeaways. And then for women, as we age, how can we get away from the ego lifting? And listen, I get it. I injured myself ego lifting, doing hip thrusts. So how can we get away from the ego lifting and prioritize recovery? So I just loved all of those tenets. And then the other sort of super nerdy thing that I love that I wrote down as he was saying it is some of the components of physical literacy. First of all, what a great word. Physical literacy or movement literacy, all over that. But he was saying balance, which is great. That's proprioception, that's joints. The stress concentration. So it's like not doing the same thing over and over and over again. So you're getting an overuse injury. Lateral movements. So I think I said coronal plane, which is the same as lateral movements. And then the one thing that I was like, oh my God, this is brilliant, which is hip flexion speed. So of course, if you trip on the corner of a carpet or your grandkid's Lego, or you just take a bad fall down the stairs or something, or if you're on a patch of icy sidewalk, you want to be able to get your foot ahead of your body as you're falling to break your fall. So of course, hip flexion speed. So I just was like, oh my God, of course, that's so brilliant. So yeah, honestly, I am just having like a bliss attack right now that I had this conversation with the legendary Dr. Stu McGill. And I'm so glad that you got to be a part of this. So let me know what you thought of this episode. What are the action items that you're going to take from listening to such, this man has shaped many professions. Like he has shaped physical therapy. He has shaped chiropractic. He has shaped massage. He has shaped any athletic therapist, any osteopath knows of Dr. Stu McGill. So his work, his name is precedes him. So I want to know what you are going to do from listening to this conversation with him and, taking some of those action items that we discussed. I'd love to hear it. I read all the comments, read all the reviews, all the things on Spotify and iTunes and elsewhere. So please, if you found some value in it, let me know what you're going to do with it. And until next time, I bid you adieu.